Working hard. Congrats on getting on getting this
Department of Public Health as the health commissioner, and what role I see us playing is that we'll be helping and talking and listening a lot to you all as community members and doing our best to provide the data in partnership with St. Vincent Hospital that the community needs, and the end goal for us all to be healthier. I personally have a special place in my heart for the Central community because we see all of the gifts that are in Central, and people like to talk about all of the challenges, but I see the gifts. The residents of Central are creative, they're dedicated, they have the capacity to work together, and I want to see a co-op in Cleveland, and I want to see not just a co-op, but a grocery store too.
I want to give you a few seconds, Mayor Bill, to say a few words and toast with us. And I'm going to hand it to you to do the toast since you know.
Okay, I can do that. Well, first, I'm just honored to be in community with you all this evening. As my team will let you know, I really believe that the best solutions come from the community, from the bottom up, at the top down. And we know that food access and food justice is a major issue in our city, and I want to get it right here in Central, and scale the good work you're doing all across the city. So that's why I'm here. I have many members of my administration here. We have a brand new food coordinator, food justice person joining our administration relatively soon, which I'm really excited about. And you have my full support and full commitment of my administration to make sure we get this effort right and show the nation how to get it done right here in Central. So that's why I'm here. That's why I'm here. So let's toast for continued success, to always doing the right thing for the people we love and the people we serve. Here, here.
This is not alcoholic, it's
Get ready to say I might be in the news tonight.
I'm the executive director of the Build Health Challenge, and I don't usually fly in for kickoff meetings, but Cleveland is very special. It is a special place, the work you all are doing, not just because the mayor's here, although that's a pretty incredible testimony to their commitment. Not just because the challenges you have, many cities have them, not just because Environmental Health Watch is the only organization we've ever funded 3 times in the Build Health Challenge. I really think it is a model for the rest of the country. The way that you guys work, the way that you work together, the commitment you have from your leadership and your anchor institutions, your community leadership, the fact that you acknowledge your history and the potential for the work that's happening here. It's a model, and I'm so honored to have learned from it over the since we started funding this work, or the work in Cleveland in 2015. Can't wait to keep learning from you all, and just thank you for having us here.
Thank you. All right. Thank you. So next we're going to do a little exercise, so we have to get up. What I'm going to do to make this easier, I hope, from Demetrius over this side, you're in group, what's that group over there? 2. From Dr. Mongolia's over, you're in group 1 over here. And I need you to line up in a straight line against the wall. If you feel certain that you will be followed or watched while shopping, take 1 step back. If you were ever discouraged from any personal goal or dream because of your race, socioeconomic status, gender, sexual orientation, physical, learning disability, take 1 step back.
They used to get corn, fresh fruits and vegetables, and I remember them going over there to Outlet where my grandmother lived at, and they would, oh, this is for Cynthia, this is for her, this is for her, and they would help, distribute the vegetables that they all went in and brought, so.
Were we surprised by anything? No. Number 2, how did it feel to be in the group that took a step forward or a step back? If you took a step back, we were not surprised. And if you took a step forward, they felt like they were an outsider. They realized their privilege. Number 3, how did it feel to be in the front or the back of the room? It was about mindset, having access, your area of privilege, the things or the outcomes that were outside of your control, basically determine if you were going to move forward or stay behind.
40 people and 6 or 7 teams, each with their own maps, mapping out where there's access to healthy food, fast food, grocery stores, restaurants, school meal programs, everything that they know about in their community. And then we began to put all of these layers together. And so the team then, I think it was just about a few weeks ago, we took a look at these maps, and these are kind of color-coded with community gardens, urban farms, corner stores, fast food, small grocery, food pantries, and then who accepts WIC and who accepts SNAP EBT. And so then we looked at these as a group, as a steering committee, and kind of what are we noticing, but also what opportunities do we have to make connections, where there might be collaborations between a garden and a pantry, or a garden and a small food store or corner store.
Process, but we moving into a whole branding process. So we'll fix that. Central Kansas Wellness Collective is the name, and so we'll move on that for now. And so the only other thing I want to do is stop for a moment, give you space to ask questions. We do have Alex, Edgar, and Justine. We gotta stick to some schedule and get things together. So I appreciate everyone's commitment, and the team has been meeting every 2 weeks. We're gonna bump it up to every 2 weeks. I appreciate everyone. And then we about to get our hands